My name's Victoria Betton, and I'm sort of Master of Ceremonies for the next sort of hour. And we're recording this session, so if you have any concerns about recording, either keep your camera off and your audio, or you could leave, but we hope you won't. We hope you'll just do that. And we'll just give people a few minutes to join the teams, and then we'll get going shortly with our fabulous panel that we're very much looking forward to hearing from, and really looking forward to the conversation. And I hope you've all brought your lunch with you, and you're sitting comfortably, having a little bit of time out from the busy working day.
I was also thinking, Victoria, if people could introduce themselves in the chat to each other, that would also be lovely.
Yes, please do. So Richard and I co-facilitating. We'll do some introductions in a minute between ourselves. We would absolutely love for you to introduce yourselves. It's always nice to see who we've got on the call, what people's interests are or backgrounds are, what's brought them here. So please do say hello in the meeting chat. And also, as the conversation progresses, please do put your questions or comments in the chat, because there will be an opportunity for a little bit more of a conversation. So yes, please introduce yourselves and ask questions or make comments, or indeed share resources as you go. Great, good to have people starting to say hello. So I think I'm going to get going. Welcome everybody. My name's Victoria Betton, and I'm chairing today's session along with Richard, and we're both here on behalf of Good Thinking, the mental health website for Londoners. Richard, would you like to introduce yourself? I'm sure everyone knows you, but just in case they don't.
I'd be surprised. Yeah, hi everyone. I'm Richard Graham. I'm a psychiatrist by training, and for the last few years have been the clinical lead for Good Thinking, which is London's digital mental wellbeing service. And this whole series of webinars around digital inclusion arose out of Victoria and I starting to work with social prescribing link workers and looking at the opportunities for using digital to support their clients. But digital poverty, digital exclusion in terms of skills were obstacles to people sort of engaging. And it's taken us on quite a journey. And I guess the key issue today is to be thinking about how digital transformation across both the health and care sectors can bring certain advantages, but there are lots of gaps, I guess, in terms of our understanding, and lots of issues about consent, I think, in terms of choice and who wants to use what sort of resource, really. So I guess, Victoria, that gives us a sort of overview of where we've got to move it. The previous 3 webinars are available via the Good Thinking site now. You can access them there. And Victoria and I will be pulling a number of themes together to take to a further roundtable discussion in December. But today, yes, we're definitely focusing on digital transformation, good, bad, or both.
The good, the bad, and the ugly. Thank you, Richard. And this is a topic that's very close to my heart, because I'm just so interested and curious about how we adopt technology within the National Health Service in ways which don't exclude people or indeed create 2-tier tracks for people when it comes to universal services. So I think we've got some really interesting knotty challenges to consider over the next sort of 50 minutes or so. I'm going to start by inviting each of the panelists just to say hello and introduce themselves initially, and just say a couple of words about why they care about this topic, and then we'll circle back round, and then each panelist will just spend a little bit of time sharing their perspective, their experience of this topic, and then we'll interject with sort of questions and conversation. And like I say, if you would like to add a question or comment or share a resource, please do so in the chat. And thank you very much, everyone, for introducing yourselves. It's good to see such a variety of people on the call. So Raz, why don't you kick us off and just introduce yourself and say why this topic is important to you.
Okay, thank you very much for the invitation to come along here and to come down south for an hour or so. And I'm really delighted to be here. And I'm also delighted to see Salim is here, because we're working with Salim on mental health and digital inclusion at the moment. So in a way, he could do this, he could sort of chip in, I think, on this one. And I know is doing some incredible work in East London. So really delighted to see you here, Salim. So I'm the managing director of a little team called Thrive by Design, who are hosted by Leeds and York Partnership Foundation Trust. And Victoria knows us very well because she founded the original version of our team, which was called Habitat, back in 2014, I think.
A long time ago.
And since 2014, our team has delivered around 200 projects, you'll be pleased to hear. Yeah. So we've done all sorts of things around digital innovation. And actually, I sort of came in just around about the same time as lockdown. And we really, like a lot of people, sort of stopped in our tracks and took stock of who we are, what we wanted to do, and how could we help the front line and so on. And we kind of pivoted our mission slightly so that we were sharply focused on tackling inequality. So we're interested in how do we overcome inequalities with digital innovation, and how do we make sure we don't compound inequalities by the digital transformation of health and care services. So you know, and in sort of thinking that through, we put together a bit of a sort of challenge, really, and we put this sort of proposal out there and said, right, does anyone want to work with us on learning how to co-design inclusion into digital transformation? And back in sort of you know, the summer of 2020, a couple of sort of people picked that up, and we ended up working with Yorkshire and Humber ICSs on building a sort of digital inclusion blueprint for sort of systems, and we ended up working with the North East and Yorkshire sort of whole health systems on looking at remote monitoring. So we got involved in the NHS remote monitoring programme, and then worked with, you know, the amazing Trish Greenhall on what inclusive video remote consultation looks like, and so on. And then we got to a point where we kind of stood back and went, okay, we've sort of looked at different bits of the puzzle. What does it look like as a whole? What does good inclusive digital transformation look like? And by the way, we were thinking about that before we saw the NHS. What does good look like? Yeah. Anyway, so we stood back and we looked at that, and we put together a bit of a canvas. And I'll tell you why we're interested in not digital inclusion, but inclusive digital transformation. And it's because we think that digital exclusion isn't a simple problem, and it also isn't an individual problem. It's a complex system issue. And I'll sort of go into that in a bit more detail later on. But what we're interested in is not fixing people and individuals, but is in fixing the system and in co-designing inclusive digital transformation. So I do think that digital transformation, we should be doing that, and it can be for all. But I think what we're going to have to do is co-design for everybody, not the majority. And that means co-designing in partnership with people who we might say are seldom heard, but people who have got great insight and great assets, and also need and deserve and have a right to health and care services. So I'll stop there for now.
That was like a manifesto. That was brilliant. And have you got a neat definition of digital transformation? Because it's one of those phrases we use a lot, but what does it actually mean?
Well, we have. I've got some slides I might sort of pick up on later.
Okay.
We've actually started to, and we don't think that we've got all the answers yet. You know, we've done a fair amount of sort of exploration and research and all those kind of things, and we're working on all sorts of different programs, like the one that we're working with Celine, which is commissioned by NHS England, looking at mental health and digital inclusion. And then there's another one that we're working with NHS England's Health Inequalities Department and NHSX on digital inequality pioneers, and there might be some people who are involved in that here as well. So you know, so we still think we're on a journey together, a collective journey. But what we're saying is it's about co-designing an inclusive digital transformation as opposed to just DT. Yes. So it's co-designing inclusion into digital transformation as far upstream as possible, focusing, and there's a bit of stuff underneath it, like focusing on building equity and changing the system, not individuals, co-designing in partnership with people, you know, this whole idea of shared strategy, pooling resources, working together, recognising the value of other partners involved. It's not just an NHS thing, it's a community and voluntary sector, it's local government and private sector. So it's really about working in partnership. And there's one really important thing, which I think is very, very tricky for us, but it's important that we recognise that poverty is a primary root cause issue here, poverty and inequalities. You know, so we have to develop a systemic approach to this. We have to recognise that there's a big wider society context to this, but that shouldn't stop us doing what we can. And we always talk about, you know, starting where we are right now, going where the energy is and building out from there.
Nice. A bit of systems theory in there as well. Yeah, thank you, Ros. Nuno, would you like to introduce yourself and maybe just say a few words about why this topic's important to you?
Hi, good afternoon. My name is Nuno. I'm the Director of Care for Nightingale Hammerson. Nightingale Hammerson is a Jewish charity providing residential care to the old Jewish community. We are based in London. We have one home in southwest London, in Wandsworth, and another one in Barnet, North London. So we are able to look after more than 300 residents. We are not only providing the typical residential care, but we have a special interest also in education, learning, and research, because we believe that is also part of a good workforce knowledge and spirit that will improve the quality of life of our residents. Now, the topic about IT integration in a care home is a topic of the day now. We know that care homes are becoming more and more digital, but there's a lot of work to be done in that area. And I will be talking a bit about what are the main concerns I have at the moment with regards to the digital integration of the care homes.
Thank you so much, Nuno. So we have like a sort of a national, sort of very strategic perspective. We have a really sort of focused, and care homes is such an important topic at the moment, and there's been, you know, so many issues during COVID. So really looking forward to hear what you have to say, Nuno. And then Bekah, great to have you bringing an integrated care system perspective. So Bekah, would you like to introduce yourself and just say a few words about why this topic's important to you?
Thanks, Victoria. Yeah, really lovely to be here. Thanks very much for the invite. So I'm Digital Transformation Manager for Bristol, North Somerset and South Gloucestershire Clinical Commissioning Group, obviously ICS, Integrated Care Board next year, and obviously already somewhat working in ICS way, and a lot of my remit is around kind of patient-facing digital and embedding user-centered design in our systems. So I'm really interested in kind of Roz's perspective on like true co-design as kind of partnership and not projects. And another area that I've been working with our team on is kind of establishing a digital inclusion strategy. So we've got a few small projects we've started in that space, but we've been thinking kind of quite aspirationally about how do we tackle it more systemically as well, recognizing it's complex and it's kind of, we don't want to be trying to solve it in the context of like, in this particular pathway or service, we need you to use a thing. We need to kind of solve it for the individuals at an individual level. So yeah, I'll talk a little bit about our strategy and some of the projects we're kicking off.
Thank you so much, Bekah. And I don't know whether you agree with this, Richard, but I'm struck by digital inclusion was such a small thing that wasn't really being considered in any meaningful way before COVID. And one of the sort of interesting sort of, I don't know, side effects of COVID is just it's become this really topic with a lot more visibility and a lot more concern around it, which I think is, you know, is a really good thing. And it's fascinating to hear about all these projects and initiatives popping up that are trying to address it both within and outside the NHS. Yeah. Anything from you, Richard, before we start the
Yeah, just it's great, really great to have Nuno here in terms of a voice for the care sector, but also I think raising, I think later, Nuno, some of the concerns about how, you know, the digital inclusion isn't a magic bullet no more than transformation is, and how those issues around consent really, which we would expect to see in other areas of public service, you know, where people are informed and sign up to whatever we're asking them to engage with. So yeah, it's going to be interesting, I think.
Thank you, Richard. So Roz, we'll come back to you, and if share some slides if you'd like to, or not. But if you could maybe speak for about 5 minutes or so and build on what you've already told us about your approach at Thrive by Design.
You read my mind. You know me. So I got some slides. Got some props. Can you see that? Okay.
Yes. Yeah.
Great. Okay. I won't be long. I won't take long because I'm desperate to hear from others. Actually, I think it's a really interesting panel you've got here. But you know, obviously, we got through COVID. Well, we haven't got through COVID. We've been through some of COVID, and you know, there's been rapid digital transformation. Whether we like it or not, it's really pushed through. And as a McKinsey report that says, we've accelerated by 7 years the digital transformation of kind of the world, really. But obviously, you know, I'm going to present so that you can see it a little bit more clearly. Right. I mean, I can share these slides with you if you want anyway, but So obviously there's, you know, a lot of concerns. There's been an incredible amount of research done that's really sort of, you know, getting down to the nitty gritty of, you know, individual sort of user research all the way to, you know, big parliamentary, you know, reviews. So we know it's a huge issue here. And I think it's particularly important. I mean, this is Good Things Foundation, who I used to work for, do a Digital Nation sort of summary every year. And, you know, at the moment, it's 10 million people lack basic skills, 14.9 very low digital engagement. And those, for us, it's really important to note that those people are more likely to need health and care services. So they're more likely to be older, living with disabilities, living in poverty and so on. So it's disproportionate need here. And this is kind of what we do at our worst. This is how we are accidentally designing exclusive digital transformation. So recognising things like it costs more. You know, you can, you know, walk through the door, or you can, you know, if you go online, you're immediately sort of, you know, paying for something. You know, what if there's no choice other than digital? You know, what about silos, sort of service delivery? As in, you know, this is just an NHS, I think somebody alluded to this earlier, but this is just an NHS service for diabetes, forgetting about all, you know, the holistic needs, the role of the community sector and so on. And this quote was taken from somebody that we've been working with recently, a young person actually. So, and they said, when I was discharged from inpatient, I was given a piece of paper with digital things, apps I could try, and it felt a bit hopeless. I was ill at a plateau, I couldn't be bothered to try them out. And you know, this is exclusive digital transformation at its worst. And these, we've done lots and lots of different bits of research, and this looks quite, I hope it looks fairly simple, but behind it there's quite a lot of you know, stuff that's gone into this. And what we've tried to do, and you can categorize digital exclusion in lots of different ways, but we tried to do it with three categories. First of all, life context. So, you know, that's everything from, you know, the physical and mental health conditions you live with, your age, language, literacy, culture, relationships, and all the way to sort of, you know, actually the house that you live in, is it private space, you know, are the walls, those kind of things, because that all these things are going to get in the way of accessing digitally enabled health and care. And then there's a whole set of things around digital skills, so motivation, digital skills, efficacy and confidence. And quite a lot of our research has talked about trust and concerns with privacy and security. And I should have said also, in the life context, poverty is all underneath all of this. And then, you know, what's often not talked about is the system side of things, although it's increasingly being discussed, I think. And that includes the digital skills and capability of staff, both to use digital, but also to support people that who are here to serve to use digital. You know, there's basics like the system not having great Wi-Fi, and you know, the laptop's not working, you know, real basic stuff sometimes, and accessibility of the tools that we're using. And also some of our research has shown about sort of digital having a bit of a brand issue, and there's sort of these expectations that digital's, you know, worse, sort of cheaper, not so good offer. And I think we in the system have sort of you know, help that along a bit, because we often talk about, oh, let's use digital because it's going to save us money and it's going to be better, you know, all those things. So the point of this diagram really is to say it's very complex, it's interrelated, and it changes over time. So this is a complex system issue. And these are like just some basic stories that, you know, these are real stories of real people that we've been talking to lately. And, you know, just pick one of those stories and you can instantly, I think, probably find a digital exclusion factor there. And, you know, sometimes when we're doing this, sort of taking a long time to deliver this presentation, we normally kind of do a bit of digital exclusion bingo. And, you know, there's a full house here, really. So, and then, you know, as I mentioned earlier, this is you know, what we've been trying to do is go, okay, so what does inclusive digital transformation look like? What does it look like when we're actually tackling this together as a system issue? And these are some of the sort of factors there. I think I mentioned all of these earlier. You know, actually one important thing is about, you know, ensuring that leadership are supporting, understand, value and supporting this, championing an inclusive digital transformation approach. We talked about working in partnership with community organisations, and the reason for that is that often they are the organisations who are trusted by the communities that we're talking about here, and also that they provide kind of, you know, holistic wraparound support in a way that sometimes the system can't, because we're focused on specific challenges and issues. And And then I put this in the chat really. Everything we've learned and all the tools we come across or we're building, we're sticking on here, so that it can be out there and useful for the rest of the system. And I think that these are the so we were sort of going, I often get asked, like, what are the sort of, what's the next step? What what's the most important thing you could give? What's the one top tip, that sort of thing? So that's this. So focusing on co-designing an inclusive system, not just fixing individuals. Always asking the question, when you're doing digital transformation, always asking the question, who might be excluded? And then co-designing for the most excluded. And I think that means everybody, not the majority. Making inclusion everyone's job. So it shouldn't be just, something. This is what I don't like about what the NHSX what good looks like policy is, that it puts inclusion over here in the corner, and I think it should be integral, right in the heart of how we're doing digital transformation. And then that other thing that I talked about, start where you are, start now. So I think I'm going to be quiet now and listen to the wisdom of the other people on the panel.
Thank you so much, Ros. And I loved your metaphor, the flowers blooming metaphor, tending to the soil rather than trying to fix the flower. That's beautiful. Richard, before we again, sorry,
I stole it off Twitter. It's not mine. I wish I was that one.
Which is a best place to steal these things from. Richard, before we move on to Nuno, any initial reflections from you?
Yeah, I mean, that really was a whistle-stop tour, Ros, and fantastic. And if you can share the slides and we can, make them available via Good Thinking, that would be brilliant, because there's so much richness there, so much consideration. I was just reminded of one thing Ellen Helsborough from the LSE sometimes says, which is the first question, is digital best? And is that in there as well? That do we always need to have that first question? And some of the research that Revealing Reality did about the smartphone is like a Swiss Army knife, but actually sometimes a different tool like a laptop with a keyboard is better for messaging than using your fingers on a smartphone. And that's why emojis were developed, to kind of get around that problem. It's just an interesting question as well, in terms of, because that pressure of it's, economically often driven, but, digital is better, almost in the same way that plastic or concrete was in the 60s.
To be honest, I wouldn't even start there. I would start with, what are you trying to achieve here? What's the outcome you're trying to achieve? And then, is digital useful in that context?
Yeah.
So I'm not really interested in digital, to be honest. I'm interested in tackling inequalities. And if we can use digital to do that and make sure it doesn't get in the way, that's the thing. I don't think any of us are really interested in that. It's a hook sometimes, a really useful hook. But what most people in the health and care system are here to do is to support the people, people to, live the best lives they can. Whether that be, living well in a care home, or, like me, I have type 1 diabetes, so I use digital to help me manage my diabetes and have a, a decent life, and means that I can wrap the diabetes around my life, not the other way around. And, that's what it's all about, isn't it, for all of us, really? And I think you often, even, people whose sole job is, CIO, digital, whatever, actually, I think sometimes people forget, and when you ask them, when you bring people in, and what we're doing into the room, people change. I think oh yeah, of course,
Yeah.
So, secondly,
it makes perfect sense, and I rather like that idea, which I sadly share, that it's the transformation and in reducing inequalities that we're interested in, of which digital could be helpful.
And I think we've got a comment from Salim. It's about convenience. It's about what's the best channel, isn't it? What's the best channel that's most appropriate in this context for this person at this time? And we need to be thinking about the outcomes that people want to achieve, rather than let's set a target to move everyone over to this channel. So totally with you. Listen, thank you so much for that, Ros. And Nuno, I don't know a load about care homes, so I'm really interested.
Well, shall I jump in at this point, Victoria? Because I know Nuno well. I've known him over the course of the pandemic, through regular sort of updates. And the degree of digital transformation, I think, Nuno, that has been thrust upon the care sector has been extraordinary, and I think the thoughtfulness and compassion for the residents that I've been hearing about over the last 18 months has just been so impressive. And so even last week you were telling me something that I wasn't aware of. So I think it'll be really great to hear about that sector, which of course we know the NHS is also profoundly dependent upon, as is society, frankly. So I really look forward to hearing what you're going to say, Nuno.
Okay, thank you for the introduction, Richard. So how should I start introducing the social care sector here? So I'd say it has been a sector that over many years has been potentially a bit neglected, the importance it has into the NHS and into the full society, that now with the pandemic we are seeing how important and the 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 role it has in the society. For example, when we were, I'm sure you've seen in the news about the hospital discharges that are being delayed. I have to say that there will be even further delays because care homes are struggling now to recruit staff. Some of the staff left. We, for example, give the example of our organization, we lost 5% of our carers. So that means we are stopping some of the admissions because we need to make sure we are able to recruit first before we are able to admit some of the residents. So that means if some residents were able to come to us because we'll be looking after them, now they need to stay longer in hospital until they find a care home. This is just an example. Now, in terms of digital transformation during the pandemic, it has been huge. It has been huge, and care homes were not prepared for it. So just simple things as you were talking about having Wi-Fi in the care homes. The great majority of care homes wouldn't have proper Wi-Fi coverage within their full home. So for residents, it would be difficult to access internet, and for relatives when they visit, and for our staff as well to be able to promote video calls with residents, for example. We were very fortunate that we were ahead in that field, and we already had studies done around the building to make sure there was coverage around the building, because we introduced in 2019 an electronic record system where the carers need to record. They have a mobile device and they will be recording the notes as they go along the shift. But the majority of care homes were still using pen and paper, and are still nowadays using pen and paper. And in terms of one of the topics I mentioned to Richard was about the IT literacy of the staff. That tends to be, in general, I'd say poor or very poor. And when we can be talking about how to switch on and off a computer. So when we think about connecting to internet, to some people, it's, you know, they can't even do the very basics. So I'd say in terms of the workforce, we may be talking about maybe 30% of people have a very, very poor IT literacy in a care home. On top of the difficulties we already had in the past, that is, like myself, English is not the first language, it's sometimes the second or the third language. And then on top of it, we have the IT integration. So there's a lot of work that needs to be done in that area. We had, during the pandemic, the CCG made compulsory for all the communication to happen through the NHS email. So the NHS email was introduced into the care homes. There was also, prior to that, the process, I forgot now exactly the name, there's the specific name for the process to get access to an NHS email. That was extremely complex. So that's why the majority of the care homes wouldn't really engaging with that. So in our case, we had a head of IT. He managed all the process, but the process was very difficult to manage for the care homes. So we have now the NHS email, but I can see from the CCG that the majority of people are still not using the NHS email in the communications with the NHS services and the external stakeholders. So there's the part of knowledge and literacy, there's the part of engagement. And we know care homes have been more than ever before stretched. They are getting even more stretched now. And I see the digital integration harder than in normal times at this stage. Obviously, the pandemic made us, we had to do it. When there was no visits, the video calls were, for example, the only way was possible for the residents to see their loved ones, but there's still a lot of work to do. Thinking now about the pros and cons of the technology for our residents, and talking about consent, for example, one of the issues we have started to see is about the use of cameras in the residents' rooms. If someone lives with dementia, the person cannot consent about it. So what's the process we should be following? We actually had a case like this 2 months ago. So we need to have a best interest decision. What are the benefits for this person in having a camera in the room? And how are we depriving the liberty of this person if we have a camera in the room? Because at home, the relatives can have a camera, they do whatever they want in there. But in a care home, you cannot be filming staff as well, and you cannot be depriving the liberty of a resident by filming them all the time if they are in the bedroom. Then there's the other issue for the integration of the IT equipment for our residents, that is, for example, about hearing impairment. One of the main difficulties we were having with the video calls was related with the hearing. So they couldn't really hear properly. Until then, we found some devices to make it possible for our residents to hear. So we need to think about the impairments the residents have in terms of integrating in the system. Then dementia is a big one, and some of the residents, we just felt after trialing that they were not really engaging. In some cases, it was causing more distress to the residents to do a video call. But it's not a blank approach saying that if someone has dementia, you cannot do video calls. No, it needs to be on a person-centered basis, that it needs to be analyzed. Touching the other topic of the electronic records that I mentioned very briefly. So the integration is happening. There's still a lot of work to do, and a lot of education to give to the team members in terms of the very basics of how to use the electronic devices, and then gradually build up on their knowledge. And the last thing, and it was already mentioned briefly by Rose, around the research that has been happening into the integration of these technologies. We had, during the pandemic, more than ever before, people trying to do research with us, things online, but to be honest, the demand was too high, and care homes in general, they struggle to participate in research, and during the pandemic, even harder. So even last week, we did our care home research forum, where we brought together researchers from different parts of England that have been researching with care homes. And the main struggle from the researchers has been about how can we engage with care homes, because it's not straightforward. It's not like you send an email and you get a reply. It tends to be much harder. You need to build a relationship with the people in the care home before they, let's say, allow you to come in and support them. It needs to be seen as you are there to add value, not to add extra work, because there's a lot of people from outside the care homes, without realizing it, with the best of the intentions, they end up generating more work into the already stretched care home workforce. So this, very briefly, Richard, I don't know whether I covered what you were expecting me to cover or not.
No, that's pretty much perfect, Nuno, and it just makes me realize how shocking it is at this point in our webinar series that we involve someone from the care sector. And I guess, Bekah, in terms of integrated care, you may be touching on that in a moment. But I just wanted to add one thought, Nuno, that actually came from your colleague Lumi, who was talking about people with dementia using either phones or tablets, and how they would be kissing and hugging the sort of devices, and really that sort of comprehension. And a resident was handed a smartphone and was told it was a phone, but it had no buttons, and so they couldn't really comprehend, and he kept handing it back. And in terms of inclusivity, just thinking about, as we did hear from Good Thinkers around learning disability, how we can help some people, because it may have reduced some distress if they were no longer seeing their relatives. But I'll pause there, because as usual, Victoria, there's so much to think about, and we haven't even got to Bekah. But that was
I know
fantastic.
I mean, thank you, Nuno. That was such a rich sort of picture that you painted of what it's been like over the pandemic for care homes. And boy, gosh, that's a tough situation to be in. Yeah, so we've had that big strategic, we've had the real sort of tangible, these are the challenges within the care home sector. I've been working with Bekah on and off for the last sort of year or so, supporting her and the integrated care system think about introducing sort of user-centered design, human-centered design as an approach across the region. And Bekah, it would just be great to hear from you a bit about your approach to digital transformation within your integrated care system. So over to you for about 5 minutes, if that's okay, 5 or 10 minutes.
Yeah, no worries at all. I do have some slides, but I'll see how we go. I was going to talk mostly about our digital inclusion strategy, which is something that we've kind of put together since early spring, and kind of stepping into this space, really wanted to start by learning what was going on in BCSE and local authority, so that we could make sure we start from an informed position, and learn a little bit about what people need to kind of tackle this as a kind of cross-organisational collaborative kind of way forward. So let me just bring my slides up now, and then I'll talk to them, and towards the end a little bit more the person-centered design stuff. So we did quite broad kind of stakeholder engagement with lots of different organisations in BNSSG. It wasn't exhaustive, and we still have loads to do. But one thing we were really mindful of in terms of how we take it forward is let's leverage all that amazing research that's been done on a national level that Ros mentioned. And apologies, because I've still got M Habitat in here instead of Thrive by Design. This slide's a little bit old. And not necessarily repeat the insight work about what's going on, like what are the barriers, because that's really well understood and it's not likely to differ kind of area to area. So we worked with VCSE, local authority, and some of our NHS partners to kind of understand what problems they had, like what insight and information they used to inform their work when they were doing stuff in this space, and put together a vision that is kind of very kind of far-reaching in terms of what we want to achieve, and we do have some specifics still to work out, but to create an approach that enables all our citizens to be digitally included so that digital can have a positive impact on their life. And actually, since we've kind of drafted this, we've been doing some engagement with safeguarding and nursing, and I think it's really important that we recognise that kind of space where it's not appropriate for people. So there's definitely like an evolution that's happening with this. And the second part, kind of taking an ICS system level perspective, is that we want to help use this piece of strategy work to inform organisations in our area about how they can help kind of measurably improve the digital exclusion that's going on at the moment in their services or pathways. So our approach is split into kind of 3 different areas at the moment, and it is very much a journey. So I think every week we're learning more about how this needs to evolve. The first one is kind of improving the data and insight that teams have to work with. So that's kind of what's population level data would be helpful for informing people's projects and digital transformation at kind of equality impact assessment stage, through to more specific pieces of research that are done. So we've been partnering with some colleagues in UE, one of the universities in our area, to make sure we're kind of like bringing in their insight. And actually, as this piece of like what area of our work has evolved, we've like found more and more resources about kind of population level data about digital exclusion. So again, like recognizing where we don't need to repeat work and working out what will be most helpful. So the main piece of work we're kind of progressing in this space at the moment is partnering with some colleagues in one of the trusts in our area who are really interested in looking at the relationship between digital exclusion and frailty. So just trying to take it a little bit more, like a little bit further in terms of how things can be used specifically in a clinical context. And the second area of work is about improving reach to support. So like leveraging the community assets that we've got, and recognising where, as NHS organisations, we can't necessarily do some of the same things that local authorities can do in terms of remit. So like collaborating as much as possible. We've started off relatively small in this space in terms of kind of pairing up pilots that are going on in the area with ongoing community-based resources. But the aspiration long term will be to have a more systematic way of people referencing what there is available, so that if they're in a kind of patient-facing or citizen-facing situation, they're able to see where can someone get help help, if it's some training or if it's like physical device access. So that's our kind of aspiration around the leveraging community assets and improving reach to support. And then this third section, which is kind of like a whole lot under not very many words, is in our kind of tools for teams, introducing program teams in BNSSG to person-centered design and to doing digital in an inclusive way up front, so that we're kind of better informed, we have the kind of knowledge and skills to make the right decisions, whether we're procuring something or building a new service. So there's still a hell of a lot to do underneath that area, and it's kind of early days in a journey of kind of sharing best practice and helping people take an approach that includes citizens before they design and deploy new services. I'll probably stop there because the slides get a bit more detailed, which is maybe not what we need today. But yeah, I just said whether there was anything else. One of the things I was going to mention under our, I think is going to inform under those tools for teams is person-centered design, information and resources around usability and accessibility, but also how to run an intervention, how to run a piece of work that will help like measurably improve what's going on, instead of just hoping that people kind of adopt the new tool that's been deployed. And we're working with Thrive by Design on a piece to kind of validate an approach to looking at digital inequalities and clinical pathways, which I suspect we've maybe been a little bit ambitious in terms of how broad that is. So we're hoping to test a model that could kind of help support people who are able to use digital and just have a barrier that they need like support overcoming, that could be reusable in different kind of pathway settings. The danger with that is that we therefore need to tackle like every barrier possible, which it'll be interesting to see how it all works out over the next few months. I'm really interested to see kind of how it works on the ground, and we're already experiencing some of the challenges of like, how do we use teams that are in primary and secondary care settings to help achieve some of this stuff when there's already an immense amount of pressure on their time. So yeah, definitely learning loads and kind of really interested to see how things develop. So I'd be really happy to take any questions if anyone has any.
Thank you so much, Bekah. And I really would like to come back to the panel on that point about competing priorities and just how stretched the system is, and how any sort of tips you've got between you for how you find and create space for this sort of really important work that might not be at the top of everyone's agenda. But before we do that, just any sort of thoughts or comments from you, Richard, on Bekah's presentation?
I was thinking exactly that, Bekah. We've been trying to look at putting the resources of good thinking into a sort of customized mail in the Accurec system that GPs could then just send out as an SMS message. And I think vaccines and boosters, and I hardly dare say this to Nuno, who's probably lived through the nightmare of vaccines from every aspect, has just taken up so much bandwidth. And of course, I think the other thing is that we are 18 months into this now, aren't we? And it's odd whether our story was on a couple of weeks ago talking about how people are kind of suppressing awareness of exactly, last year didn't happen, and yet it did. And so we have a tired workforce as well. As well as a low-paid workforce and low-skilled, and as you said, Nuno, English may not be first language, so there are lots and lots of barriers. So the whole area of inequalities is amplified across the board, doesn't it? And goes back to what you were saying, Ros, about poverty underpinning all. So yeah, there's lots of really goodwill, but capacity is the challenge.
Well, building on that point, and please do put questions or comments in the chat, or put your hand up if you'd like to come in and say something or ask a question directly. But just building on that point then about, with all these competing priorities, the stretched workforce, how have you each managed to create some space to deal with these sorts of really important sort of systemic issues? And Nuno, perhaps we could start with you, because you've clearly been doing a lot of work on this topic. How have you managed to sort of galvanize people when there's so many other pressures?
Well, there's two approaches in there. There is the approach of it's for the well-being of the residents, to protect yourself because you're going to have better recordings and we're going to help you to improve. And then the second approach is it needs to be done, and there's no discussion about it, because we need to give a time frame for things to happen, because otherwise things will drag on and will never happen. So, you know, we went through the integration of the electronic care records during the pandemic, because we started in 2019 and we carried on in 2020, and it was something that just needed to be happening. And that meant, in terms of the leadership team implementing it, working beyond your normal hours, but that's something common in care homes. Yeah. And giving a lot of support and repeating the same thing 2 and 3 and 4 and sometimes 5 times until it gets into the person's head. And to be honest, the best support tends to be also, sorry, my light went off. Best support tends to be the peer support from the colleague that works next to you. So you are working on the shift next to that person and you just ask, how do you do this? How do you do that? So we've done, for each group of staff, we've created some champions, let's say, in how to use the electronic record system. So we have some more localized support for the team members, because we couldn't have the head of IT replying to 300 staff members about some very simple issues, because he doesn't even know those things. No, it's about the day-to-day work of the system. They need to have someone that knows how to use the system. So that has been our approach.
Yes, thank you. And I love what you said about peer, you know, just galvanizing peers to sort of help each other. We've got some questions coming through, which I'll pick up in a minute. And maybe, Bekah, you could look at the question from Salim. But before we come to you, Bekah, I'll just ask Ros the same question, really. So how have you sort of tactically managed to create some space for this with your clients and the people that you work with?
I mean, we didn't go to people. We put a thing out there, and people came to us. So I think there's something about, you know, well, I put in the chat the Myron's maxims, which some might know, and I think we've sort of followed that accidentally in some ways. You know, just using sort of our own experience and empathy, and the fact that we're actually in the system, so we're not sort of doing two, we're part of it, and we're very close to the front line, so we really know what's going on, certainly in our part of the world. And one of the things is people own what they create. So there is the NHS part of this is constantly trying to sort of take something that was good over there and dump it over there and scale it up. It's all about scale. And actually, this has got to be done from and this is the value, I think, of integrated care systems in the future. It has to be done from this, the place up, in a way. And taking and sharing best practice and learning and supporting each other and so on along the way, but we own what we create. The second thing is around that real change happens in real work, and we've just heard that in what and Bekah have been saying. I don't need to say any more on that, I don't think. And the third thing is about or fourth thing, sorry, is about and I know, actually, I've missed one, haven't I? Those who do the work do the change. So that's interrelated to the second one. And then connecting the system to more of itself. And that's something that we're trying really hard to do, is to connect people with each other. So we know that so-and-so's got a really good sort of mapping tool that will be useful for Milton Keynes. So we connect the two and so on. And I think we're going to be doing more of that in the future, creating a network of networks, if you like, a messy network. And some of that happens organically and will happen organically. And some of it is about holding the space. And then the thing that I've talked about earlier about starting somewhere, encouraging people to start where they are, go where the energy is. And that's certainly what we did with Yorkshire and Humber ICSs. We went there and we said, look, here's sort of some of the stuff. And we did a bit of a survey, and we worked out, for example, in West Yorkshire and Harrogate, there was a lot of assets around digital and data poverty, and also a lot of people worrying about that. And that was the thing that we focused on there, because that's where the energy was, and so on. And then the last one is about the processes to get to the future as the future you get. So this is often and always, really, when you're co-designing, that process of getting to know each other and working out something together and build, recognizing that asset over there and getting them in and then shaping it, that's just as important as the end product, and always will be. And I think those things are probably best how we work and how we sort of create that space. And I think the other thing is that not everywhere is the context and the what's going on in different ICSs or care homes or whatever sort of space you're looking at is going to be different. And there's some people, you're looking at the diffusion of innovation curve. There's some people who are up there up front, want to do it. I can see we have two of those people on the panel with me here today, are real innovators and early adopters. And then there's others who are going to wait until you've done the hard work and they'll be influenced by you and so on. And I think we have to recognise that that's part of our the way that we're made up as well. So taking some of those theories really and applying them in reality.
I'd really encourage people to look at Myron's maxims. They're deceptively simple, but there's such deep thought behind them. And I think that sort of leaning into complexity and building on assets and working where the energy is a really sort of powerful things to do, and a sort of the antithesis, as you say, to the let's do this here and scale it there, and it just, you lose that sort of humanity.
It makes, because I go, oh, it's all really complicated, and it's all about poverty, and everyone goes, and then I say, but start where you are, start where the energy is, and it makes it doable, and you can take that first step. And I mean, that's human, isn't it?
Thank you, Rosie. 100%. Bekah, would you like to come back? And this is a related question from Salim about how did BNSSG come to realise that this digital inclusion strategy was needed, and have you got any thoughts about how we could help? What are the hooks for integrated care systems to prioritise this sort of work?
Yeah, thanks for the question. It does link on from what we were talking about. And I think even though we're experiencing some early challenges with kind of teams on the ground's capacity to help us get people involved in testing out that kind of digital support model that I spoke about, despite that being the case, there's been a huge appetite in the clinical pathways we've got involved to take part, actually, because people have been needing an answer to this and not knowing what to do about it for quite a long time. Obviously, it kind of accelerated during COVID as well. So I think in our system, it probably is in response to what we've heard from citizens through insight and engagement. That during COVID, this sort of stuff's happened at such a speed that maybe it has exacerbated things. The other thing I guess I'd say for now in terms of where we're at is it doesn't feel like we have a huge amount of investment and funding behind it yet. I'm covering it as part of a wider role, and we have someone in our team who's looking after kind of tech-enabled care in collaboration with the local authorities around digital maturity in care homes and that sort of thing. But as soon as you start, you feel like we need so much more. And one of the things we heard from local authority and VCSE partners in that early engagement we did was that short-term investment is really difficult to turn into making an impactful difference. But that's where we've got to start to kind of prove the value and demonstrate what's working. So we've been applying for bids like this small project, which Thrive by Design are helping lead, which will help us get off the ground and start evidencing a need for more consistent funding behind it.
Thank you for that that insight, Bekah. And I'm just aware we've just got a few minutes left, and I wonder, Richard, whether it might be a moment before we thank our speakers and let everyone get on with their day, whether it might just be worth sort of just talking about next steps, because this is the final of 4 webinars on this sort of topic, and we now have a follow-up sort of roundtable, don't we, with some senior people.
Yeah, I mean, I don't know whether we'll be repeating, Ros, what you've been achieving, which feels a bit embarrassing now, but we're hoping to pull together all the insights across the webinars to bring together, I guess, what we can share then with our colleagues in primary care and hopefully the care sector, insights in how to sort of, what might be helpful in terms of digital inclusion, particularly interested in some of the research on how to convey digital skills and how to do that well, and peer support may be as good as it gets. Thinking about the health economics, if that's the right description, but some of those drivers within the health space that enable something to be prioritized if the value can be articulated to those that manage the purse strings. And I think we're also quite interested in, and Nuno, you mentioned about Wi-Fi in the care homes. some sort of digital inequalities impact assessment that again might help an organization think through where some of those pitfalls might be. It may be around accessibility, it may be around Wi-Fi. We were hearing about the homeless needing charging points. So lots of things to think about. But then finally, also keeping in mind, and I'm still sort of increasingly troubled, Nuno, by the disclosures about cameras coming into nursing homes as employers have been using them across the pandemic. We're not also forgetting all those potential harms of surveillance and so on that can just creep into this space because you can do it, it starts to happen, and really thinking about what liberties our own, our clients and so on might also be impacted upon. That may come into the inequalities impact assessment, I guess, but yeah, we're going to try and bring all this together, and hopefully some of you will be helping us develop some real advice and guidance for people in the health and care space.
Thank you so much, Richard. And I noticed that you put a link to the previously recorded webinars, and we'll have all 4 up on Good Thinking's YouTube channel. It just leaves me to say a massive thank you to Nuno, Bekah and to Ros for your insights and just a brilliant panel discussion. So thank you so much for your time. Thank you to everyone who joined us, and I hope you have a lovely rest of the day.
Yep.
I think we're done. Thank you very much.
Yeah, thanks everyone.
Take care, everybody.
Bye.
Bye. Goodbye.
Bye.